given our history over the last 6 years or so, could not escape the sense that, all right, here's an outbreak starting on a cruise ship. What's going on?
Dr. Bill Messer, an infectious disease expert and professor at OHSU, believes the risk is low for a hantavirus global pandemic. But he says there are still questions about new transmissions that need to be evaluated.
We need to watch and not be dismissive of symptoms or risk of people who are sitting, close to people on airplanes, things like that, because we really just don't know.
Messer says this appears to be the same Andes virus that first appeared in the 1990s in South America. With person-to-person transmission, hantavirus can usually be traced back to exposure to mice and rat droppings. Those at Multnomah Vector Control say there's only been one case of hantavirus in the county in the past decade, and the patient survived. They say prevention is key. What are the biggest mistakes you see people making?
I think it's just thinking that, it'll never happen to me and just kind of diving headfirst into these really dusty, dirty areas.
Levi Zahn says it's important to play it safe around garages, sheds, anywhere deer mice could be spreading disease.
You just leave the door open like this. If there's windows on the shed or building, we open those up, let that breeze go through for at least 20 minutes, longer if possible.
He says to wear protective clothing, a mask and eye protection when cleaning up mouse or rat nests. Don't use a vacuum or broom, which can send the virus airborne. And wash down items with a 9-to-1 bleach mixture.
You just go in there and you spray all the surfaces that you see where there's a bunch of dust on it.
He recommends blocking access holes larger than a dime with steel wool or grating.
Have a lot of stuff laid up against the side of the building, so the rats and the mice like to kind of hide behind those things.
And the professor has his lecture on hantavirus this Friday for students here at OHSU. He says with all this information coming in, including that update on the Ben doctor, his lesson will be changing day by day. Back to you guys.
Libby Dowsett on Markham Hill this evening. Thanks, Libby.